Good day everyone, I'm Johnny Balmeo, your clinical instructor for this subject, NCM112, or also known as the care of the clients with problems in oxygenation, fluids in electrolytes, infectious, inflammatory, and immunologic response, cellular aberration, acute, and chronic. So for today, we will have a little discussion about oxygen saturation and measuring autosat using pulse oximeter. Then checklist and principle, then last will be the demonstration of the COC1, which is the measuring oxygen saturation using a pulse oximeter. So first, let's discuss what is pulse oximetry. So when you say pulse oximetry, it's actually a method that measures the percentage of the blood hemoglobin carrying oxygen. Many healthcare professionals consider oxygen saturation as one of the vital signs. Now, how about the pulse oximeter? So when we say pulse oximeter, this is actually a device, a non-invasive that estimates a client's arterial blood oxygen saturation using a device, or should I say using a sensor in which you will attach it on your finger or some other parts of your body. Then it will easily tell us about the oxygen saturation of your body. What else? The oxygen saturation is actually the value or percentage of all the hemoglobin binding sites that are occupied by oxygen. Remember, sa may RBC natin, nandiyan po yung hemoglobin. And then si hemoglobin is the one that carries the oxygen. And yun ang mini-measure ni pulse oximeter. Now, how does this device measure the oxygen saturation? Well, it has two parts. The first one is the two light-emitting diodes, or the LEDs. Okay, the one is the red color, and then another one is the infrared. So, you might think, paano po makakapasok yung ilaw na yun dito papunta rito sa kabila? Merong buto. It's all because of the infrared. Then, sa may ilalim will be the photodetector. Yun naman na magme-measure noong light na pumapasok. Okay, so don't forget that those are the two parts of our pulse oximeter. What else? The normal oxygen saturation is 95 to 100%. And 70% is considered as life-threatening. Be informed lang pagka bibili kayo ng pulse oximeter, be sure na babasahin niyo yung manual because most of the pulse oximeter, especially this one, the cordless and the fingertip pulse oximeter, most can only measure 90% to 100. Below 90%, yung iba nagkakaroon ng problema. So be sure lang na babasahin ninyo yung user's manual para malaman ninyo hanggang ilan kaya ang kaya na itong i-read. Okay? But don't forget 95 to 100% ang normal na oxygen saturation natin. And then 70% is considered as life-threatening. Okay, next. There are various types of sensors that are available. Okay, hindi lamang po ito. Okay? If you will be asked, Sir, paano po kapag po wala pong kamay or daliri ang pasyente sa natin ilalagay? Well, most of you will answer, Sir, sa may earlobe po. Question, pwede ba itong ilagay sa may earlobe? Answer is, no. Bakit? We will use a different sensor for that. Let me show you a picture. Kung mapapansin ninyo, dito sa may picture natin sa baba. Okay, this is actually a tabletop pulse oximeter. Then as you can see here, andito yung, what do you call this one? The sensor. Let's try to look at this picture. Okay, this is the fingertip, the one that I am using. Fingertip or the cordless. Okay, then what else? We have here the handheld. For the handheld, meron niya ang cord, and then there is a sensor. Okay, ang handheld, makikita niyo yan in the ER or even in the OR. How about the tabletop? Tabletop sa mga special area, an operating room, delivery room, and even in the ICU. Makikita niyo itong mga tabletop na to. Okay, next. How about the different sensors? As you can see here, okay, meron tayong iba't ibang sensors. We have here the universal hinge sensor. Okay, we have here for the small finger. Then sa may baba, we have the soft sensors. And then the last will be the pediatric soft sensors. Pangbata po yan. Okay. For every pulse oximeter, there's actually a sensor. So once na inopen mo yan, tutunog na yan. And then once it reaches the reading, pag may final reading na siya, okay, it will tell us by simply having a beep. Then, pagka rin naman masyadong mababa, below normal, tutunog din po ito. Ganun din sa may pag-measure ng pulse. Kapag ang pulse is beyond or below normal, well then tutunog din po ito. Okay? Next, what are the factors that may affect oxygen saturation? Okay, number one dyan is the hemoglobin. Okay, since hemoglobin is saturated with oxygen, if it falls to below normal, the pulse oximeter will still read it as normal oxygen saturation. Yes, pwede niyang ma-measure na normal pa rin yun. This can happen in an anemic client. I still remember nung nandun kami sa may operating room, sa may ward kami, there was one patient na merong OGIB or upper gastrointestinal bleeding. Anemic siya. So we tried to check for the oxygen saturation and you know what we found out? Normal. Pero, mababa ang kanyang RBC. And as we all know, pag mababa ang RBC, mababa rin ang kanyang hemoglobin. Pero ang na-measure namin sa kanyang oxygen saturation, normal. So, it can really happen. That is one of the drawback of the pulse oximeter. Hindi niya kasi kayang sabihin na anemic ang isang tao because it measures the oxygen saturation in the body, not really the hemoglobin. Okay? Next one, we have the circulation. If ever there is an impaired ang circulation. For example, in my arm, there is a cast. Meron akong cast dito sa may kamay ko, and that cast impedes the circulation. And then you check for the oxygen saturation on my finger. Okay? Possible na mababa ang makuha ninyo na oxygen saturation. So be sure lang na kapag kukuha tayo, hindi na i-impede yung circulation. Walang impairment. Okay, next, activity such as shivering o kaya naman activities lalo sa mga pedya. Kapag kaganyan ang mga pasyente natin, be careful. Kasi minsan natatanggal, then ikakabit natin, minsan magiging output na niyan is irregular na. Irregular na po yung magiging reading. So we need to be sure na intact yung pulse oximeter natin. Next, we have carbon monoxide poisoning. This is another problem kapag ang pasyente natin nagkaroon ng carbon monoxide poisoning. Our pulse oximeter might not be able to differentiate the saturation of the carbon monoxide to oxygen saturation. Pwedeng mabasa niya is the carbon monoxide, hindi yung oxygen. So magkakaroon na ng problema with the reading. Okay, next, we have the delegation consideration. Can we delegate the measurement of the oxygen saturation to an NAP or the nurse assisted personnel, or in Philippines we call it the nursing aid? Pwede kaya tayong mag-delegate sa kanila? Pwede kaya sila ang mag-measure ng oxygen saturation ng ating client? Answer is yes. Pwede tayong mag-delegate sa kanila. Remember, this one is non-invasive. Since this is a non-invasive procedure, pwede. Okay? Provided na we will tell to our NA or NAP what are the factors related to the changes. Ano kaya mga factors na pwedeng magbago dun sa reading? So we have to tell that to the NA. What else? We have to inform the NA about the appropriate sensor sites and the appropriate probe. For example, walang kamay ang pasyente mo, walang daliri. So saan natin pwedeng ilagay? So we have to instruct our NA na pwede niyang ilagay sa other parts of the body. Okay, pwede rito sa my forehead, even in the bridge of the nose. We can also use the earlobe, even the around the arm, around the foot. Pwede yun. Depende sa case natin. Okay, what else? We have to advise our NA about the frequency, kung gaano ba kadalas tayong kukuha ng oxygen saturation. But actually, sometimes it depends din sa sa order ni doc. Okay, nakadepende rin din yun. Okay, there are some doctors who will tell you na monitor mo yung kanyang oxygen saturation every hour. So, sundin natin yun. And then we have to tell that to our NA. Okay, what else? We have to advise our NA to notify the nurse immediately. I-notify niya tayo immediately kapag mayroong problema with the oxygen saturation. And also request the NAP from using the pulse oximeter in measuring. Okay? Tandaan nyo, no? We have to refrain the NA when it comes in measuring the pulse of our client, especially kapag ang pulse is irregular. Kaya ano yung sabi ko sa inyo kanina? This one only estimates the oxygen saturation. At the same time, it estimates the number of your heartbeat. Okay, meaning to say, hindi po siya ganun ka-exact. So, still, mas maganda, manual pa rin. I-manual mong i-check yung pulse ng pasyente mo instead of using this one. So, wag mong isipin na nagmamadali ka, I'll just use the pulse oximeter. No, wag dapat. So, we have to tell that to our NA2. Okay, next, how about the lifespan consideration? Ano ba yung mga dapat natin i-consider in using the pulse oximeter. As you can see in the picture, there is a neonatal. Okay? Ang ginamit po rito na probe is, ayan, for pedia, nilagay dun sa kanyang big toe. Ayan. So, we have to consider the appropriate size of the finger or toe para sa mga pasyente natin. What else? The oximeter may need to be taped or wrapped with an elastic bandage. Nang sa ganun, hindi po matatanggal, lalo na sa mga pedya, sa mga makukulit. Okay? Well, sometimes it depends din naman kung ano ang gagamitin natin. For example, ito ang gagamitin mo. Kaya madali po itong matanggal. So, if you're going to use naman the sensor, what do you call this one? The probe na wired, okay, i-attach mo lang naman yun sa may pasyente, pwede natin yun lagyan ng adhesive tape. Okay, especially yung mga sensor na nilalagay dito sa may forehead or kaya sa may bridge of the nose, okay, kailangan na ng adhesive. Next, for the children, we have to instruct the children that the sensor does not hurt. Ang problema kasi kapag pumasok na si nurse sa may ward or dun sa may room ng bata, minsan natatakot na sila. Kaya natatakot sila pagka nakakita sila na person who's wearing a pure white. Okay, bakit? Because it is because of the upbringing of their mother. Tinatakot kasi ng mga magulang, yung mga bata. So, we have to tell to the children na yung ilalagay natin sa kanila is hindi nakakasakit. Okay? Especially this one is non-invasive. So, we have to tell that to our client na mga bata. And then last is for the older adults. Okay, merong mga gamot. Okay, there are certain medicines such as vasoconstrictors na pwedeng makipag-impede ng circulation. So, we have to take in consideration to that. What else? For circulation, also the thickened nails. Okay, it may the pulse oximeter may read it inaccurately kapag ganun yung mga case natin. Okay, next, we will now move on to demonstration time. Okay, if you have some question, guys, regarding the short discussion, just put it in the comment section. Then we will try to answer that on our consultation time. Okay, let's now start the demonstration time for the measurement of the oxygen saturation using pulse oximeter. So let's start with our goal. Our main goal here is to make the patient exhibit arterial blood oxygen saturation within an acceptable parameters or greater than 95%. So what are the equipment that we needed? First is the oximeter, the oximeter probe or the oximeter sensor. Or if you don't have, we can simply use this one, the fingertip or the cordless. What else? Acetone or the nail polish remover if needed. What else? Pen and vital signs flow sheet or the electronic health record. Be aware lang din na it depends on the institution where you are working. Some other institutions, they have a different sheet for the monitoring of the pulse oximeter. So in addition with that, we also need an alcohol and also cotton balls. Okay, let's now start with the implementation. We have to review the chart for any health problems that would affect the patient's oxygenation status, especially if our client is taking a medication or has a problem in the lungs. Okay, kailangan i-assess natin ang pasyente natin. What else? Bring necessary equipment to the bedside stand or overbed table. Kaya na sa ganun, mas accessible sa atin ang procedure na gagawin natin. Perform hand hygiene and put on the PPE if indicated. Always remember, if you will only required to do it, then do it. Pero kung hindi naman kailangan, if it is not really necessary, then you do not have to wear gloves or any other PPE because nakaka-offend yun sa part ng pasyente. Next is identify our patient. Okay, since nung HA time pa, tsaka nung fundamentals, we already told you how to identify our client by simply asking them or check for the door tag, okay, the bed tag, or by simply checking kung available yung wrist tag. Okay, what else? Close the curtain from bed, around the bed, and then close the door to the room if possible. This is to provide privacy to our client. Next, select an adequate site for application of the sensor. So, saan tayo maglalagay? We can actually use the index or the middle or the ring finger. Okay? Next, check for the proximal pulse and capillary refill at the pulse closest to the site. Check natin. Okay? Check natin for the capillary refill. For what purposes, sir? Okay, para ma-check po natin kung proper ba ang blood circulation doon. Okay, next, if the circulation at the site is inadequate, well, we have to consider other parts of the body such as the earlobe, the forehead, bridge of the nose, and other parts of the body. Okay, what else? Use a toe only if lower extremity circulation is not compromised. Pero kung sa tingin nyo naman, okay naman ang circulation doon sa may lower extremity, then go. Pero as much as possible, we discourage to use the lower extremity in measuring the oxygen saturation using a pulse oximeter. Next, select a proper equipment. Okay, if one finger is too large for the probe, then definitely you have to use a smaller one. Use probes appropriate for patient's age and size dahil hindi lahat ng probe at hindi lahat ng pulse oximeter ay appropriate para sa mga age ng bawat isa. Next, check if patient is allergic to adhesive. Bakit? Kasi some other pulse oximeter and also sensor, they require to be stick with adhesive tape. Okay, para sa ganun, hindi malaglag. So, kung ang pasyente natin is may allergy sa mga adhesive tape, then that will be a problem. May magkakausa ng irritation. Next, prepare the monitoring site. Okay, cleanse the selected area with the alcohol, wipe, or disposable cleansing cloth. So, if I'm going to use my index finger, okay, using a cotton balls with alcohol, okay, linisin natin ito mabuti, then allow it to dry. Same thing goes with the pulse oximeter na gagamitin natin or the sensor na ididikit natin. For example, ito ang gagamitin mo. Okay? What you need is, okay, wipe mo muna yung baba. Then next is yung sa taas using a cotton balls with alcohol. Pero be sure lang na kapag ginamit mo ang cotton balls with alcohol, hindi masyado marami ang alcohol because pwede yun pumasok dun sa may sensor. Okay, next. If it is necessary, guys, kung merong nail polish or merong cutics ang pasyente ninyo, okay, pakitanggal lang yan because it may impede and we might not get the exact number ng oxygen saturation. Next, apply probe securely to skin and make sure that the light emitting sensor and light receiver sensor are aligned opposite each other. Okay, so I already told you guys that the light emitting diode is nasa taas, then ang sensor naman is nasa may baba. So, kailangan naka-align po dapat yan pag nilagay natin. Then, connect the sensor probe to the pulse oximeter. Ngayon, kung gamit mo naman yung katulad dun sa akin, which is the fingertip or the cordless, then you can just simply put it on the finger. Okay, then turn the oximeter on. Then, check the operation of the equipment. Kung gumagana, then that's good. Okay, magkakaroon ng reading yan. Pasensya na, di nyo masyado makita kasi this one doesn't have, what do you call this one? Yung light sa likod. What do you call that one? Okay, or check nyo na lang, doon sa may picture dito sa may taas. As you can see there is actually two sets of numbers. We have 98. That 98 is actually the oxygen saturation and then the 77 is the heartbeat. Okay, next, check oxygen saturation at regular intervals, then as ordered by primary care providers, then nursing assessment, and signaled by alarms. Next, remove the sensors on a regular basis, lalo na kung ang pasyente natin is for monitoring. Check natin. Ngayon, kung ang pasyente natin is gumagamit ng spring tension sensor, katulad po na to, spring tension yan, we have to check it every 4 hours. Ngayon, kung ginamitan naman natin yan ng adhesive finger or toe, okay, check natin yan every 4 hours. Okay? Every 2 hours kapag ka dito, sa spring-loaded. Then every 4 hours naman for the adhesive. For what? To check for the irritation. Next, clean the non-disposable sensor according to the manufacturer's direction. Or yung tinuro ko sa inyo guys, okay, kapag tapos gamitin na to, wipe nyo sa may baba, and then wipe sa may taas. Okay? Then remove the PPE kung gumamit ka, and perform hand hygiene. Then last will be the documentation. Document kung ano man yung mga ginawa mo. If sa tingin mo, nagkaroon ng abnormality with the reading, for example, below 95%, you have to notify the doctor and you have to chart it. Ngayon, kung normal naman na lahat, then chart mo pa din na nakuha mo is normal range. And that ends our discussion. Thank you very much, guys, and I hope you've learned something today. Once again, stay safe and God bless.